As men get older, certain changes in the body are simply part of the journey. One of the most common, and often the most overlooked, is prostate enlargement. The medical term is benign prostatic hyperplasia, or BPH. By the age of 50, almost half of all men experience some degree of prostate growth. By the age of 80, that number can rise to 90%. While this condition is not cancer, it can greatly affect daily comfort and quality of life. The prostate is a small gland about the size of a walnut. It sits just below the bladder and wraps around the urethra, the tube that carries urine out of the body. Its main job is to produce fluid that nourishes and protects sperm. But over time, this small gland can slowly get bigger. As it enlarges, it starts pressing against the urethra and bladder. This pressure causes common urinary problems. You may notice frequent trips to the bathroom, especially at night. You may feel like your bladder doesn't fully empty. Starting or stopping urination can become difficult, and the urine stream may feel weaker. For many men, these changes happen gradually. At first, they might think it's just part of aging, something they have to live with. But ignoring these symptoms can lead to bigger problems later on. If the bladder cannot empty completely, it increases the risk of urinary tract infections. In more severe cases, it can lead to bladder stones or even kidney damage. The good news is, prostate enlargement is very manageable when you understand what's happening inside your body. Science has given us clear answers about why the prostate grows and what you can do to take control. In this video, we'll break everything down step by step. First, we'll talk about 5 major reasons why the prostate enlarges with age. These are based on solid research, explained in simple language. Then we'll look at natural management options, including specific ingredients that have been shown to support prostate health. We'll also explore lifestyle and exercise tips that make a real difference. By the end, you'll have practical knowledge that you can act on today. Let's begin. Now let's look at 5 clear reasons the prostate often grows as men get older. First, hormonal changes. As men age, the balance of male hormones shifts. An enzyme called 5-alpha reductase converts testosterone into a stronger hormone named dihydrotestosterone, or DHT. DHT tells prostate cells to grow. Over many years, even small increases in DHT inside the gland cause steady prostate enlargement. That is why medicines that block this enzyme often shrink the prostate and improve symptoms. Second, chronic inflammation. Long-term low-grade inflammation inside the prostate can quietly stimulate cell growth. Infections, immune reactions, or repeated irritation may bring in inflammatory cells and chemical signals. These signals, like interleukins and TNF, encourage prostate cells to divide and can cause scarring. That scarring and swelling make urinary symptoms worse. Third, family and genes. BPH often runs in families. If your father or brother had prostate problems or surgery, your chance of developing an enlarged prostate goes up. Scientists have found genetic differences that can make prostate tissue more sensitive to hormones or growth signals. In short, family history is an important clue. Fourth, metabolic and lifestyle factors. Conditions such as obesity, insulin resistance, and high blood sugar are linked to bigger prostates. High insulin and a related signal called IGF-1 can act like growth promoters for prostate tissue. Extra belly fat also increases an enzyme called aromatase, which shifts hormone balance and can promote prostate growth. That is one reason losing weight and controlling blood sugar can help. Fifth, age-related structural changes. With aging, the prostate's makeup changes. Smooth muscle cells can increase, collagen can build up, and the tissue becomes stiffer. Even if the gland does not get enormously larger, this stiffening can squeeze the urethra and make urination difficult. Also, aging cells can behave differently and encourage the tissue to grow. Put simply, prostate enlargement is usually the result of several forces working together. Hormone changes, inflammation, genes, metabolic health, and how tissue changes with age. Knowing these reasons helps you and your doctor choose the best, targeted steps to reduce symptoms and protect urinary health. Many men can support prostate health using natural ingredients that have been studied in clinical research. These are not miracle cures, but they can help reduce symptoms and slow further enlargement when used consistently. The first is saw palmetto, a small berry from the Serenoa repens plant. Saw palmetto blocks the enzyme 5-alpha reductase, the same enzyme that turns testosterone into DHT. By lowering DHT inside the prostate, it can reduce excess cell growth. It also has natural anti-inflammatory effects. Many studies show it can improve urinary flow and reduce nighttime urination. The second is beta-sitosterol, a plant compound found in fruits, vegetables, nuts, and seeds. Beta-sitosterol is well known for improving urinary symptoms in men with BPH. It seems to calm inflammation and may influence growth factor signals inside the gland. Several high-quality studies found that men taking beta-sitosterol experienced stronger urine flow and less urgency. The third is pygeum, made from the bark of the African plum tree. Pygeum has compounds that reduce inflammatory chemicals called prostaglandins. It can relax bladder muscles, improve emptying, and limit fibroblast growth inside the prostate. This makes urination smoother and reduces pressure. The fourth is stinging nettle root, also called Urtica dioica. Nettle root appears to bind to sex hormone-binding globulin. This changes how hormones are available to prostate tissue, which can slow growth. It also provides antioxidant support. The fifth is lycopene, the bright red antioxidant in tomatoes. Lycopene naturally concentrates inside the prostate. It helps lower oxidative stress and may reduce DHT levels. Regular tomato intake or lycopene. Supplements have been linked to slower prostate growth in several studies. Other important nutrients include zinc and vitamin D. Zinc supports the structure and function of prostate tissue. Deficiency is linked to enlargement. Vitamin D influences cell growth and immune balance in the gland. Adequate levels are associated with better prostate health. These natural ingredients are often available in foods or in standardized supplements. Always check quality and talk to your doctor before starting anything new, especially if you take prescription medications. When combined with lifestyle changes, these ingredients can support healthy hormone balance, reduce inflammation, and help keep the prostate from enlarging further. Lifestyle plays a major role in both the prevention and management of prostate enlargement, especially after the age of 50. The choices you make every day can either support a healthy prostate or quietly increase the risk of BPH over time. One of the most powerful steps is maintaining a healthy weight. Extra abdominal fat increases estrogen levels and insulin resistance. This combination encourages the prostate to grow. Losing even a small amount of belly fat can bring hormone levels into better balance and reduce inflammation. Physical activity is another key factor. Regular movement improves blood circulation to the pelvis, lowers inflammation, and supports hormone balance. For men over 50, the best routine includes at least 150 minutes of moderate activity per week. This can be brisk walking, swimming, or using a stationary bike with a comfortable seat. Gentle resistance training 2 or 3 times a week also helps maintain muscle mass, which supports overall hormone health. Pelvic floor exercises, also known as Kegels, are simple but powerful. These exercises strengthen the muscles that control urination. To do them, contract the muscles you use to stop the flow of urine, hold for 5 seconds, and then relax. Repeat 10 to 15 times twice a day. With regular practice, you can improve bladder control and reduce dribbling. Diet matters greatly. A Mediterranean-style diet, rich in vegetables, fruits, whole grains, nuts, seeds, legumes, olive oil, and fish, provides antioxidants and healthy fats that protect the prostate. These foods reduce inflammation and help regulate blood sugar. Limiting processed foods, sugary snacks, fried items, and excessive red meat is especially important after 50. Bladder habits also make a difference. Try to limit caffeine and alcohol, especially in the evening, since they can irritate the bladder and increase nighttime urination. Avoid holding urine for too long and empty your bladder completely each time. Stress management is often overlooked. Chronic stress raises cortisol, which can worsen inflammation and hormone imbalance. Simple daily practices like deep breathing, light stretching, meditation, or spending time outdoors can keep stress in check. For men over 50, these lifestyle habits are more than just good health tips. They are a practical way to keep the prostate healthy, maintain comfort, and reduce the risk of BPH as the years go on. Consistency is the key. Prostate enlargement is one of the most common health issues men face as they get older, but it does not have to control your life. By understanding what causes it, using natural support wisely, and following a healthy lifestyle, you can take real steps to protect your prostate and maintain comfort. If you're already noticing symptoms like frequent urination, weak urine flow, or a feeling that your bladder isn't emptying fully, the most important thing is not to ignore them. These signs are your body's way of asking for attention. Early action often leads to better results, fewer complications, and less need for aggressive treatment later on. Start by talking with your healthcare provider. A simple checkup can help rule out serious problems and guide you toward the right combination of natural management, lifestyle changes, and medical options if needed. Remember, prostate enlargement is not the same as prostate cancer, but both deserve attention, especially as you move beyond 50. Consistency is key. Natural ingredients like saw palmetto, beta-sitosterol, pygium, nettle root, lycopene, zinc, and vitamin D work best when combined with regular exercise, a balanced diet, and healthy daily habits. These choices lower inflammation, balance hormones, and support the tissues of the prostate in a natural way. It's also never too early to adopt better habits. Even if you don't have symptoms yet, taking care of your weight, being active, managing stress, and eating nutrient-rich foods can help prevent problems later. Think of these changes as an investment in your comfort, independence, and long-term health. Prostate health is an important part of overall well-being for every man over 50. By staying informed and making thoughtful decisions, you can stay ahead of problems, feel more confident, and keep enjoying life fully. If you found this information helpful, consider sharing it with friends or family members who might benefit. Many men silently live with these issues, thinking they are simply part of aging. Awareness can make a difference. Take charge of your health today. Small steps, taken consistently, lead to lasting results. Your body will thank you for it.